Hello, I'm Kayla Roman, and I'll be highlighting top professionals providing senior financial services. Today we are meeting with Trevor. Hi, Trevor.
Hi, how are you?
I'm good. How are you?
I'm doing great. Thank you for having me.
Awesome. Do you want to start off just by telling us a little bit about yourself, hobbies, what you like to do for fun?
Yeah. So my name is Trevor Zehring. I reside here in Central PA, specifically in the Dauphin County area. Um, I've been in the health insurance and Medicare space for the last 7 years, going on 8. And what I like to do for fun besides working, I like going to the gym and hanging out with friends and family and going to different sporting events and just kind of relaxing and maximizing my rest whenever I can.
Great. Thanks for sharing that with me. What led you to working with seniors specifically on their specialized insurance needs?
Yeah, so it's crazy how it all came about, but I used to be a personal trainer back in like 2014, about 2017, and then um, I like because I got into that because I wanted to help people, but I didn't see myself doing that long term as a career. And my older sister was actually in the space for about 18 years prior, and she told me about it, and she pretty much explained all I needed to do is get my license, and she would pretty much mentor me through the first year or so. So I went on about 100 home appointments with her, and sat through about 40 in-person seminars and just listened to her talk over and over, watched her without even doing anything beforehand, and got a good feel for how everything worked and how the industry was. And then I ended up falling in love with it. And from there, I ended up getting a job as like a captive agent with like a big organization. And I worked there for a long time and then eventually went out on my own.
Awesome. That's cool that it was like a family thing for you, and that's how you got into it.
Yeah, definitely. And actually now me and my sister, we actually run an agency together. So it's still a family thing.
Yeah, that's cool that you can work with your sister. I don't know if I could work with my brother.
Everybody says that. Our,
Yeah,
our our personalities are so different that we complement each other.
good.
Yeah.
Can you describe some of the biggest challenges that you see your clients facing regarding their financial situation?
Yeah, I think now more than ever, obviously, with everything else going on in the world, prices of like medications, co-pays, things like that. Everybody's very conscious of their spending in those regards. So I think the financial aspect is one of those challenges, but also I think now more than ever, what I see in the field is that a lot of Medicare beneficiaries, they they're not properly equipped from, whether they do their own research, whether they sit down with, an agent. I think from start to finish, they need to be better equipped with the information to be able to make the best decisions that they can make. And I
Yeah.
think I think that in a lot of areas, us as agents need to do better in terms of educating and just laying out all the options for individuals so that they can make the best decision for their needs year over year.
Yeah, I think there's just so much information out there, and that's why they need guidance. What are some of the biggest concerns that you help your clients resolve?
Yeah. So um, number one, I think is back to the educational standpoint is, whether it's somebody new to Medicare or somebody that's just looking to change their plan, I try to get an understanding of what they understand so far and then fill in those gaps for them. That way, by the time, we're done talking or sitting down, they have a really good understanding of how everything works, even at the base level. That way, they can feel comfortable about the decisions that they make. And then on the financial side, I would say, and it's a pretty popular one issue for people is just the cost of medications. It's getting better and better over time with help from government regulations and things, just like how the insulin bill was passed a couple years ago. But um, I think a lot of my clients, I help them with kind of understanding what help is out there for different expensive medicines. There in Pennsylvania, there's a PACE program, and when at the federal level, there's extra help, but just trying to help them and understand and get them the resources they need to be able to fund a lot of these more expensive medicines if they need to.
Yeah. Without divulging any specific details, can you tell us about a time that you helped a client achieve one of these goals or overcome one of these challenges?
Yeah, so it actually happens quite frequently, but like I mentioned, in Pennsylvania, there's that PACE program to help
Yeah.
individuals depending on income levels and different things like that. But every maybe once or twice a month, I'm usually coming across somebody that we verify and look at their income and look at what medicines they're taking. And if it's something that one, they just can't afford, or two, they've been paying for a long time without understanding or knowing that this help is out there, we'll sit down together, we'll get PACE on the phone, and we'll help them apply for that over the phone together. And then within 2 to 3 days, if they qualify, they end up getting a lot of these medications for, a fraction of what they were paying previously.
Okay. Yeah, that's really important. My mom is diabetic, so she's gone through this a lot with like the prescriptions just being out of control with the pricing. Yeah.
I can relate to that. My dad, he was a type 1 diabetic, and when he was alive, his insulins, before there was like that cap, and he was
Yeah.
always hitting the coverage gap or the donut hole, and it took a toll on his pockets because of at that point in time, it was about 7 or 8 years ago. At that point in time, there was no really huge assistance for insulins.
Yeah. If you had a crystal ball and could see into the future, what do you think is going to be the biggest challenge for seniors in the financial market in the next 3 to 5 years? We won't hold you to it.
I think right now the biggest challenge is relating to just some of the things I talked about, is just the support side of things, is, dealing with somebody local that you can go to for answers, for guidance, for education is number one going to be the most important thing to seek out. And I think it's a challenge right now because, like you said, there's so much information, and you got to find somebody that you trust and want to deal with on a year-to-year basis that can help you, guide you through all these different changes that are happening. But I also think that just understanding that things are going to change year over year, and it's both, as an agent and as a beneficiary, it's both people's responsibility to do their research and do their due diligence and understand that whatever your needs are for that year, you need to look into your plan, and you need to sit down with somebody that can help you do a solid review of what your needs are going to be for that following year.
Yeah. Great. Well, thank you so much for meeting with me today and sharing a little bit about yourself and what you do and just the senior financial market in general and how it's going. I appreciate it.
Thanks for having me.
All right. Thanks, Trevor.
Thank you.
Bye.